All right, so we're going to move on to our next part. First of all, we just really want to congratulate you. And this is the agenda of today, to introduce you to each other, to really talk about expectations of this grant and what you're receiving, to learn from past and learn a little bit about some of the inequities of this grant, because it's really focused on the reason that you were awarded this grant is to really focus on inequities in our communities, and both from the past and also moving into the present. And then we're also going to give you some time in small group breakouts to really get to know each other a little bit, to get to know our staff also a little bit, and really have a chance to share who you are. So that's the overall agenda for today. We'll be going from 11 to 1. And then we will have an extra hour from 1 to 2 for anyone that has questions or comments or concerns, maybe about your work plan or about anything else that you want to ask. I mean, so that part is not mandatory or not a part of the actual program. It's that you can leave if you are ready to at 1. So that's the overall agenda. Thanks for everyone saying good morning in the chat. And then we'll go to the next slide, please. These are just what we're hoping you'll get out of today. It sort of mimics the agenda. You'll get to congratulate each other, meet us, and at the end, you'll be able to really understand the expectations and identify communities of color and how you are disproportionately impacted, that are disproportionately impacted by this virus, and finally participate in some networking. So thank you for today, for being here. So now we are going to introduce the staff. We've introduced some folks already, but probably the people you're going to interact with the most are who we call our TA leads. And within the next week or so, you'll have one TA lead that will be identified, that will be the TA lead that's communicating and connecting with you. So we haven't quite identified that yet because we're increasing our staff to support all these grantees, but you will know that very soon, who is your primary contact here. So I'm just gonna, Tamika Francis, who's at the top of the picture there, wasn't able to be here today, neither was Kelsey able to be here today. So I wanted to say that. And I also wanted to say that Bethel is new with us, so I didn't have her picture yet, but she is here and will introduce herself. So I'm just gonna pass it to Stacy and ask people to unmute and go around and introduce themselves.
Hi, I'm Stacy Chacker, and I really look forward to working with all of you and with whoever I am supporting. I've been at HRiA for over 12 years and work on a variety of projects. And maybe I'm saying too much. I should just say my name.
That's okay.
Sorry, I'm going to Elena.
Hi, everyone. My name is Elena Bengochea. I'm a program associate at HRiA and a TA lead for this project. I'm just really excited to be here with all of you, and I'll pass it to Kelly.
Hi, everyone. Thanks so much for being here. My name is Kelly Dankert, pronoun she, hers. I'm a training associate at Health Resources in Action. And again, really excited to work with you all and meet you. I'll be supporting the comms and also taking on some TA lead opportunities. And I'll pass it to Maiwa.
Hello, Maiwa Sanusi. I'm a research associate here, also a TA lead. Look forward to working with all of you. And I'll pass it to Tamaki.
Hello, everyone. I am Tamaki West. I am a director at the Health Resources in Action. He is pronounced she, her, hers, and I'm very excited to work with you. So thank you for joining us today.
Great, thank you. Bethel.
Yes, hi, my name is Bethel. I'll be a new program manager here at HRiA. I'm super excited to be here and to meet you all and getting to be a part of the great work that you guys are doing.
Great, thank you, everyone. And so those are the TA leads who you'll be in direct communication with, particularly the one that your project will be assigned to. But I also wanted to introduce additional support. Daisy Ortega is the director of the project. She's actually off this week, so wasn't able to be here, but you will definitely have communication from her. I've already introduced myself, and Karen Schoeneman is really overseeing communications for this project. And communications are a really big part of how you're communicating. And we'll be talking about that. What are the key messages, and what does the overall funder, which is the Department of Public Health, really need from us and hoping for us. And then I'm going to ask Jasper, who already mentioned themselves, but will introduce themselves too.
Hi, so I will be your helpful tech point for this meeting. So if you have any technological issues, feel free to reach out to me in the chat. Just once again, posting because I see folks are still trickling in. When you enter the meeting, please make sure that you select at the bottom of your screen, the small globe, to be able to select the language that you would like to listen to. So that this way, make sure that everybody has equal accessibility to the meeting. I use they, them, theirs pronouns or no pronouns, and I'm a program coordinator, so I kind of have my fingers in a lot of different pies here.
Great. Well, thank you, everyone. So we're going to move on. Feel free, if you have questions, to put them in the chat, or you can also raise your hand in the participant hand raising thing, or wave at us. We are happy to answer questions as we go along. But we wanted to really start out with a big congratulations to you all. We are very happy to be able to award you this funding, and to really have you as those credible messengers, as those folks in organizations go out into your communities and really help provide strategies to provide mitigation and work with folks so we can really end this pandemic once and for all. And, as a byproduct, maybe continue to build those amazing relationships you already have in your communities and meet new folks possibly. So congratulations. Just to say a little bit about the process, and then we will hear, and you can certainly ask us more about it. Additional funds were made available from the first round of funding, where we had over 145 applications. So we had a lot of applications, and there was over $5.5 million were requested through those applications, and we only had 650,000. So we had a lot less to give out at that point. So there was a first round of grantees. You are our wonderful second cohort. We were able to fund 18 more grantees from this first group. And so we are really happy that you were able to take this funding, and also that you were able to shift it. We know it's work because since the fall, there's the whole addition of the vax conversations and education that's been added. We are actually funding a whole new round, which we're calling our third cohort, and also some sites that are focusing on Native Americans, 4 different groups that focus primarily on, or specifically on, Native American populations. And when those aren't quite set yet, but when those groups come on, we'll have 65 groups and have distributing close to $4 million. So we really appreciate your patience and your understanding as we work through all of this. We really hope that you will work with us. We know you will work with us, and know that it's very important to us that you are all here, and we want to get to know you. Again, we want to be able to thank you as much in every way that we can. And so I just wanted to read this quote because I think it is so important that you take this in, that nonprofits like yours, especially community and faith-based organizations, are our country's only institution solely focused on making communities stronger. In the toughest times, you do the toughest work. When it's time to restore and repair our well-being, you are equipped to do that as well. You measure success in terms of shared benefits, not private profits. To weather the worst and rebuild, our state and country need this kind of community-minded perspective. So thank you. I hope that you take this in and really let it settle with you that you're really doing the work of we need the work in our communities. And I know you may know that, but we want to know that we know that as well in our organization. And does anyone want to say anything or have any comment now? We are going to have you introduce yourselves verbally, so you will see who's in the room. We want to take time to do that in a moment, but just wanted to settle with that. Actually, if you can go back a couple slides just so we can see who actually was awarded. This is who is awarded and what we call our second cohort, which is you. So you can see all the other organizations here. And I know a lot of people put that in the chat already as well. But we just want you to be able to network with a lot of organizations. And Stacey, if you could go back one more slide, just so you also know, this was the first cohort. So they're not here today. This is who we've been working with since December. You can look, or I think November, December. So you can look through these because starting in a week in May, mid-May, well, May 12th, I think is the first time. We're going to have everyone together so you can all share and learn with each other. So you may know some of these organizations as well. But today we are focusing on your cohort. So you can go again, Stacy. And we do want to hear who is here. And I just want to give a moment to make sure anyone has any comments or thoughts. Okay, great. One thing I know, because I've done quite a bit of work in El Paso where we work with folks on the border and we always have translation, is that I tend to speak very quickly. And I know I'm trying to speak more slowly because it makes it easier for translation. And you can have the presentation. We will email it to you with a feedback form about the session at the beginning of next week. So on that point, I'm going to turn it over to Stacy to lead us through some introductions.
Okay, hi everyone again. We're going to go around and introduce ourselves. I am going to call on each organization. Again, I'm Stacy Chacker, she, her, hers. I forgot to say that before, at HRiA, Health Resources in Action. And one of my favorite things about spring is watching my plants come up and watching trees bloom. And we'd like to pass it off to the Asian Women for Health organization. I know there's a number of you here, so you guys just pass it off to each other. That would be great.
Hi, I'm Chan Som. I am the Communications Operations Specialist for Asian Women for Health, located in Somerville, Massachusetts, but we do serve other populations around Malden, Dorchester, and such. And I'll pass it on to Feng.
Oh, can you guys, if you could share your pronouns if you want to, but also just an icebreaker question, just anything.
Yeah, so I use they, them pronoun. And for my favorite time of spring, I believe I was actually born in April, but I have really bad allergies. So it's a lose-lose situation for me right now. Yep, and I'll pass it on to Feng.
Hi everyone. So I'm scared as there's some noise in my place. So, but anyways, I'm a program coordinator at Asian Women for Health, and very nice to meet you all. Yeah. So I'm going to be pass this to Chin Chi.
Chin, are you on mute maybe? Is there someone else that you could pass it on while she's trying to figure out?
It's always only us three from the organization.
Okay.
Yeah, but we can go to another organization. I believe Chan Chi's in, but I'm not too sure if she is part of the meeting. But yeah.
Okay. How about the Boston Black COVID-19 Coalition?
That'd be me. Good morning, Cheryl Clyburn Crawford. I use the She series with the Black Boston COVID Coalition. And what is my favorite thing about spring? I think my favorite thing about spring, well, it's my flowers. I love the way the flowers come up and how resilient my flowers are. Even when spring comes up and it tries to act like it's winter and it snows on them, the flowers still came back. So I just love my flowers. Thank you. Am I passing it or are you passing it?
Do you have someone else from here from your organization? I was going to say that's like a great metaphor for the work that we're all doing together. Is there someone else here, Cheryl, or just you?
No, just myself today.
Okay. So I'm calling on the Brockton Area Multi-Service Organization, and I'm teeing up the Community Economic Development Center. So get ready.
Hi, I'm Pam Verklin, she, hers. I'm from BAMC, short for Brockton Multi-Area Services, Inc. I am the Vice President of Marketing, Philanthropy, and Communications. My favorite thing about spring, I have a four-wheeler and I love to go four-wheeling. So it means the snowmobile can go away and I can go out and get kind of muddy. I'm gonna pass it to Liz, who is here from BAMC also.
Hi, I'm Liz. I use she, her. I'm the content coordinator at BAMC. And my favorite thing about spring has to be baby animals. I saw some little ducklings crossing the street yesterday, and that was pretty exciting.
Awesome. Anyone else here?
No, we just ended up having Liz and I attend today.
That's great. There's no pressure on anyone. I'm just making sure we're covering everybody.
Yeah, thank you so much.
Okay, I've never heard four-wheeling used as a verb, but there we go. So Community Economic Development Center, and if anyone's here, I'm not sure if there is from Elevate New England, if you would go next, that'd be great.
Sorry, quick interjection, Stacy. We have some asks. If you could please stop sharing the slides, that this way folks can see each other when.
Oh, okay, sure. Absolutely. Makes life easier for me too. Okay, there we go.
I am Corinne Williams from Community Economic Development Center in New Bedford. She, hers, and the thing I like most about spring is new birds coming into my backyard.
Nice. Okay, Corinne, do you have anyone else with you?
Yeah, Brian.
Hi, I'm Brian Pastori. I'm sharing screens with Corinne, and obviously I use he, him pronouns, and I like just being outside and not being cold.
Nice. Okay.
That's
anyone else? Anyone else?
No, that's it.
Okay, Elevate, and then Greater Lowell Health Alliance. I'm not sure if Elevate could be here today. Is anyone here from Elevate New England? Okay, we'll come back at the end and see if anyone was able to join us. So now Greater Lowell Health Alliance, and then next we have the International Institute of New England.
Good morning, everybody. I'm Carrie Dentremont, Executive Director for the Greater Lowell Health Alliance, and my pronouns are she, her, and hers. And my favorite thing to do in the spring is probably early morning walks on days like today, beautiful days.
Nice.
And then I do have my entire team, our amazing team of 4 here today.
Nice.
So I will gladly pass it off to, let's see, Amanda Claremont next.
Good morning, everyone. Amanda Claremont. I serve as the Community Engagement Coordinator for the Greater Lowell Health Alliance. I use she, her pronouns. And one thing that I really love about the spring is waking up and hearing the birds. And it's very, very serene. And I will kick it over to Dr. Hannah Tello.
Good morning, everyone. My name is Hannah Tello. I use she, her pronouns. I am the Community Health Data Manager for the Greater Lowell Health Alliance. And my favorite thing about spring, I know this sounds odd, is hearing the kids outside my house yelling while they play. It's just I think it's a really pleasant sound to hear the kids outside. And I will pass it off to Devin Goldberg.
Good morning, everyone. My name is Devin Goldberg. I use she, her pronouns, and I am working on the Healing Community Study at the Greater Lowell Health Alliance. My favorite thing about spring is my birthday is also in April, so I'd say I thrive. Thank you.
Thank you so much. It's great to have your team here. So the International Institute of New England, and after that, we have the Jewish Family Service of Midwest.
I can go first from the International Institute of New England. Hi, everyone. I'm Emma Tobin. I use she, her pronouns. I am the Chief Program Officer at the International Institute of New England. And my favorite thing about spring is hanging out on my deck, which overlooks a big city park, and just being outside and being warm. And I will pass it off to Zan Weber. I think. Zan, are you here? Okay, so instead I will pass it off to Anka Muraru.
Hi everyone, my name is Anka Muraru. I am the Boston Managing Director at International Institute of New England. I am using she, hers pronouns. And my favorite things about spring is all the flowers blooming in my garden.
Nice. Anyone else?
Passing it to Caroline.
Hi, my name is Caroline Rowe. I am the Lowell Managing Director at the International Institute of New England, and I use she, her pronouns. And my favorite thing about spring is going hiking and getting outside. Thank you.
Anyone else from your guys' crew? Okay, so Jewish Family Service and Latinos Unidos and Massachusetts.
Good morning, buenos dias, boker tov. I'm Lino Covarrubias. I'm the CEO of Jewish Family Service in Metro West here in Framingham. I use he, his, el pronouns. My favorite part about the spring, I grew up in California, in Southern California, so I grew up with grass year round, every foliage year round. So spring reminds me of home. So glad to be here, and I'll turn it over to Rosie.
Hi, Rosemary Coelho. I use she, her, hers. I'm the Chief of Learning Performance and Strategy here at JFS of Metro West. I do want to say that the agency can boast that more than 50% of our 65 staff represent cultural, linguistic, ethnic, racial diversity, with 9 languages spoken by staff. Spring offers a promise of new beginnings.
Nice.
And I'll turn it over to Lucia Panicella.
Oh. Hi, Lucia.
Hi, I'm Lucia Panicella. I'm the Senior Director of Programs and Partnerships at JFS. I use the She series. And my favorite part of spring is watching my kids play Little League.
Nice. Anyone else with you guys, or?
That's it.
Okay, and I'm going to give a boker tov back to Lino. Okay, Latinos Unidos, and then Multicultural AIDS Coalition.
Yes, good morning, everyone. It's my pleasure to be here. My name is Lucy Pineda. I am the Executive Director of Latinos Unidos in Massachusetts, located in Everett. What I love to do in the spring, walk and clean my backyard.
Nice.
So let me pass to Maria Partida.
Hi, everybody. My name is Maria Partida. I live in Nantucket Island. I use the pronouns she, hers. I represent Luma. I serve as the president of the organization. I love the spring because daffodils are all over the island. Due to the pandemic, we couldn't have our parade, but we can't wait for it to happen next year. And I'll pass it to Glenda. Lucy?
Linda here? Okay, well, if Linda joins, we could bring her back in. Multicultural AIDS Coalition, and then New Life.
Everybody, I'm here.
We have Franny too. I don't know if she's.
Oh, okay.
Morning. Hello, good morning. My name is Francesca. Nice to meet everyone here in this group. And I represent Luma. And my favorite thing in the spring is my flowers, and my bird.
Sweet.
I love to come outside and see my birds.
Nice.
Thank you.
Anyone else from Luma? Okay.
Mi nombre es Glenda Trigueros, miembro de Latinos Unidos de Massachusetts, Luma. Me encanta la primavera.
My name is Luma, and I love springtime. I love the colors of the tulips. And I feel happy to be here participating with you, interacting and learning a great deal. And hello to everyone. Thank you.
Any other Luma folks? Okay.
We'll
Okay, Multicultural AIDS Coalition.
Hi, everybody. I'm Gary Daffin, the Executive Director at Multicultural AIDS Coalition, also known as MAC. We're in Roxbury, Massachusetts, which is a neighborhood of Boston. And favorite thing about spring, I live in Jamaica Plain, so being able to go around the Jamaica Pond would be my favorite thing.
Gary, I hope to bump into you there. Okay.
And I'll pass it to Jennifer, then Samuel.
Good morning, I'm Samuel from the MAC organization. I'm the HIV coordinator here. My pronouns are he, his, and him. What I like about spring is really walking outside with a hot, warm coffee in my hands and feeling the warm showers falling my face as well. That's beautiful.
Good morning, Jennifer Davis. I'm a manager at the Multicultural AIDS Coalition. Pronouns are she, her, and hers. And my favorite thing about spring is that all the ice cream shops open back up right around this time. So.
I'll meet you there, Jennifer.
I'm ready.
Okay, New Life Community Empowerment Center, and then North Shore Latino Business Association. Anyone here with us from New Life?
Oh, Bishop, it looks like you're on mute.
Okay, can you hear me? Thank you. Good morning again, everybody. My name is Orlando Harris. I am the Executive Director of New Life Community Empowerment Center. My favorite thing about spring is winter is over. Winter is over, and no more snow, no more snow. And I'm gonna meet you all at the ice cream place, Cookies and Creams. And I'm excited about serving and working together, partnering to change and better our community. So thank you. I'm going to, at this time, and again, Orlando Harris, I'm going to pass this on to one of our team, Sandra Kersey.
Good morning, everyone. My name is Sandra Kersey, and I am the program manager here at New Life Community Empowerment Center. I use the pronouns she, her, and hers. And my favorite thing about spring is the blossoming of the trees and the flowers coming out. Thank you. And now I'll pass it over to Kayla Harris.
Good morning. My name is Kayla Harris, and I'm the Young Adult Community Outreach Representative for New Life Community Empowerment Center in Brockton. I use the pronouns she, her, and hers. And my favorite thing about spring is the warm weather coming in. Thank you.
Anyone else from New Life?
Hi, my name is Tirsa Ramirez. I am for Latino Health Insurance. I work at health educators. My favorite is a spring flowers tree. So thank you.
Great. Anyone else from your team at New Life? It's great.
I believe that is it. Thank you, Stacy.
Okay, thank you. A young person here with us as well. I love that. North Shore Latino Business Association.
Yes, hello, my name is Frances Martinez, E for her, she and ella.
I am the president, founder, CEO of the North Shore Latino Business Association / Center. And I love the spring. I have a huge backyard and I have flowers. I have a very special tree that turns pink, yellow, white, and then green, and it's beautiful. I have a lot of roses, tulips, and everything. So you can imagine that I do spend a lot of time when I'm free in my backyard. So I'm happy to be here and thank you so much and hello to everyone. And that's it for my team.
Okay, and Francis, if you could tell us what kind of tree that is and report back, I'd appreciate it. But
I forgot the name, so I was like, I know that question's gonna come up, but I will the next time.
Okay. Okay, I'm gonna get this name wrong. Sarepta Women and Children's Empowerment Center Synergy Partnership.
Yes, how you guys doing? My name is James Sidiskar. It is a pleasure to be here. In terms of season, I think I like all season, but I prefer, since I'm from the Caribbean, I prefer to be by the beach. Yeah, but the only thing is just I have allergies. So I have seasonal and tropical allergies. So no season is really good for me. But it is a pleasure to be here and I'm looking forward to working with you all. Thank you.
Thank you. Anyone with you?
No, not at this time, but
okay.
Next time we didn't know if multiple people can be there, but
okay, thanks. That's great. Thanks, James. I'm having a joint committee for children's health care in Everett, and then afterwards we'll have LHIP, the Latino Health Insurance Program. So
Hi. This is Kathy Viveros. I'm the executive director for the Joint Committee for Children's Health Care in Everett. I use the she, her, hers pronouns. My favorite thing about spring are the flowers, and I'm particularly fond of tulips. And I am joined today by our outreach coordinator, Samia Bennett. So I'll pass it over to Samia.
Hi, everyone. Good morning. My name is Samia Bennett. I'm the outreach coordinator for the Joint Committee. It's a pleasure to be here. My favorite thing about the spring is I like the rain, you know, and thank you.
Okay. Anyone else with you guys? Okay, so we're going to move on to the Latino Health Insurance Program and then the Mass Coalition for the Homeless. Anyone here? I know they told me yesterday they were coming. Latino Health Insurance Program?
Yes, I am Tirsa Ramirez. I represent a couple minutes, so I represent for Latino Health Insurance. I work for health educators. So I'm here.
Okay, thank you.
Yes. Thanks.
Okay, the Mass Coalition for the Homeless and then the Psychological Center. Do we have anyone here from the Mass Coalition for the Homeless? Okay, I thought we had someone register. Okay, oh, here we go. Karina? No.
Hi, my name is Karina Papalato. I'm the Chief Executive Officer of the Psychological Center in Lawrence, Mass. We have 3 programs. Daybreak Shelter is our homeless shelter, and we have Pegasus House in Women's View, which serves females who are struggling with addiction. I have she, her pronouns. Then what I like about spring is that it starts staying lighter out later, and I can wear my open toe shoes. Put my boots
nice. Okay, anyone else with you from the Psychological Center?
My chief of staff's going to get on, but she's not here at the moment.
Okay, and going back to the Mass Coalition for the Homeless, is anyone here? Okay. How about the YWCA in Malden?
Hi, everyone. Good morning. My name is Chris Murphy. I'm actually the Mass in Motion Coordinator for the City of Malden / the YWCA. I also run the TASK program here, which is a Teen Peer Leadership Program for high school girls. I also don't use any pronouns, and I'm really excited to start working on this and getting the community involved.
Great.
I'm
Thanks,
going to pass it off to Chris Glenn, who's also on the call.
Good morning, Chris Glenn, YWCA Program Assistant for Mass in Motion at YWCA in Malden, and I use she, her, hers.
Great.
And favorite part of spring is just everything being alive again.
Nice. Anyone else from you guys?
Sorry, Sabrina Montero.
Hi, my name is Sabrina Montero. I work here at the YWCA task program. I use she, her pronouns, and I think my favorite thing about spring would also be like the really good weather coming and the flowers blooming.
Nice. Okay. Anyone else with you guys? Okay. How about the YWCA of Western Mass? Anyone here from our YWCA out in the western part of the state? Okay, so I'm going to go back up to see if anyone's been able to join us from Elevate. Is anyone here from Elevate? Elevate New England? So I'm going to call on all three of you. The Mass Coalition for the Homeless and YWCA of Western Mass. Is anyone here from any of those organizations? And if you're here, but you can't speak, just put it in the chat. Okay, so I think we're going to go back to the slideshow and continue with our program. I just want to say we are so psyched to have you all here and to be have the honor of working with you all. There's our chat box here at HRiA is exploding a little bit with excitement about many of you. So just to say that it's a great honor for us as well. And of course, I'm having a second moment trying to share. So here we go.
And if folks maybe just want to unmute and give a big round of applause to all of you and a big thanks to all of you. Yay, congratulations. You have to unmute, but.
Yes, yes, yes. Congratulations.
And thanks also for taking that time. I know it takes a while to share, but we really everyone have a chance to hear their voice in the room. Thank you.
Awesome. Well, I think I'm going to kick off this next section of our presentation. So just to quickly reintroduce myself, my name is Elena Bengochea. I'm a TA lead for this project. And now I'm going to speak a bit now about the purpose of this grant program and our program model. So next. So first and foremost, we know that communities of color in Massachusetts are among the hardest hit by COVID-19 in terms of infection, illness, and death. So the goal of the MA COVID-19 Community Grants Program is to reduce COVID-19 infections, morbidity, and mortality among Asian, Black, Indigenous, Latinx, and other people of color in the hardest hit cities in Massachusetts. The COVID-19 community grants engage community and faith-based organizations in the development and delivery of effective messages and further support hard-hit communities with education, training, and funding to effectively meet their community-specific needs. So on March 17th, 2021, just about a month ago, or a couple months ago now, the Baker-Polito administration announced the release of federal funds as part of its vaccine equity initiative to increase vaccine trust, acceptance, and administration rates among priority populations. So this initiative focuses on 20 cities and towns with the greatest COVID-19 case burden, considering social determinants of health, of course, and the disproportionate impact of COVID-19 on Black, Indigenous, and people of color. The 20 cities and towns are Boston, Brockton, Chelsea, Everett, Fall River, Fitchburg, Framingham, Haverhill, Holyoke, Lawrence, Leominster, Lowell, Lynn, Malden, Methuen, New Bedford, Randolph, Revere, Springfield, and Worcester. So we also want to mention that this grants program is a part of a much larger state strategy and that we work with the state to ensure that there's alignment and synergy. And lastly, that these grants are administered and managed by Health Resources in Action, who is us, a nonprofit public health organization that helps people live healthier lives and create healthy communities through prevention, health promotion, policy, and research in partnership with DPH. Next slide, please. All right, so now I'm going to speak a bit more about the aspects of this grant program model. So each grantee will have a dedicated HRiA lead, as LJ mentioned earlier in the presentation. And this lead will help provide technical assistance and individualized support throughout the grant period. The support will involve monthly one-on-one check-ins, as well as additional meetings if so desired. Your TA lead will always be available to answer any questions or address any concerns you may have. And in this way, they will serve as your main point of contact for the grant. That being said, our whole team will be working to support grantees, so you will get to know many of us over the next several months. We'll be reviewing the approval process later in this presentation, but as a quick note, all messaging that you do about COVID-19 vaccine and COVID mitigation strategies for this grant will need to be approved by HRiA and DPH, meaning that grantees should submit any flyers, posters, or videos, etc., to your assigned TA lead. We do promise it will be a fairly quick process and hopefully pretty painless for you, with about a 1 or 2 day turnaround that HRiA will facilitate. And as I mentioned, there will be additional detail and opportunity to ask questions about this approval process later in this presentation. We also want to note that we are evaluating this program. So we will be asking you all to provide some brief updates on a weekly basis about how your work is going, how much and or what kind of outreach your site has conducted in the past week, what kinds of challenges you may have, what big wins you may have had recently, as we like to call them. And this info will be collected using a Google form, which we will send out the link to at the beginning of each week, and we'll send out reminders about this. We may also at some point ask you to participate in a brief interview with your TA lead to help with the evaluation of this program. And moving on to the second item on this slide, we at HRiA will be hosting weekly, maybe moving eventually to bi-weekly sessions that we very fondly call Vax Power Hours, where we will provide updates on the latest COVID-19 news from the state, best practices, peer learnings, and where we also want to raise up just the amazing work that you are all doing. These Vax Power Hours are mandatory for attendance unless we indicate otherwise. Sometimes, some weeks, we may decide to cancel a meeting or make it not mandatory, but in general, we do want everyone to attend. You do not always have to send the same person from your team to each of these meetings. You can take turns attending, though we do want to stress that it's important that whoever does attend these Vax Power Hours be directly involved in the grant's work so that you can be able to report back to the grant team at your site. We will send out all the dates for the upcoming Vax Power Hours in an email, and we'll also send out the calendar invites for each session. I also want to mention that for these sessions, we will have an interpreter in attendance, just like today, who will be simultaneously interpreting from English to Spanish. If there's anyone on your team who would like to attend these sessions but would need interpreting in another language or other accommodations, please bring this up with your TA lead or feel free to reach out to one of us by email. And lastly, through these Vax Power Hours, TA check-ins, and emails, we will be facilitating communications about the grant, and we'll share any concerns or questions that may come up from you all with DPH to inform state strategies. Next slide, please. And just to go over some important dates, your funding will be mailed out to you after all of your paperwork has been completed. Most of you have already submitted the paperwork, hooray. But just a reminder for those of you who have not yet done so, this includes your signed grant agreements and may also include an updated budget if one was requested. So next week on Wednesday, May 12th, instead of a Vax Power Hour, we will be having a drop-in session to help answer any of your questions about this grant or about your work plans, which are due on that same day. The drop-in session next week is not mandatory, though we do encourage you to join us if you'd like to. You should have received an email with info about completing your work plan, and we will also talk about your work plans more later in this session. So just to reiterate, those are again due next week on Wednesday, May 12th at 5 p.m. Funds do need to be spent down for this grant by December 31st, 2021 at the end of this year. And your end of project progress reports will also be due at the end of the grant, but this date is TBD for now, so we'll get to that much later. Okay, so I know that was probably a lot of information. So now I'm just going to quickly pass it to LJ, who will open it up for any questions from all of you. LJ, you're on mute.
Muted. I wish I had a quarter for every time someone told me I was muted. I would be rich. But just put in the chat about the drop-in session next week. So this is the time for questions, time for any anything that you just heard that you are concerned about. As I said, we will also be doing breakout rooms later today before we close at 1, and so you'll have a chance if you think of them as we go along. But any thoughts or questions now about this process or what we're asking of you?
Hi, this is Kathy from the Joint Committee for Children's Healthcare in Everett.
Sure.
And, just one overarching question. In the work plan, we have to provide timelines. Can you give us a reasonable estimate as to when we can likely start officially doing things, understanding that we may need to get approvals for things, we need to get our aid assigned to us? What should we be looking at by way of a start for those work plans?
Well, as soon as you sign the agreement and you accept the funding, you can start your work plan. I think the part of approval is that because it's DPH and federal funds, and we have to get in any kind of particularly any kind of written or video, that has to get approved. Although, as Elena said, your TA will explain to you that turnaround, and it should be pretty quick. They meet every week. And they try this group that does the approval at DPH and the governor's office, and they try to do that quickly. And we try to help process that. So I think in terms of your timelines, you can start them, next week and at the beginning, and it will go through to December. Does anyone other TA lead want to add to that, or Kelly, in terms of communication? Elena? Oh no, she said good. Pam had a question. Did that answer your question, Kathy?
Yes, I think it did. I'm just concerned that we set a timeline and then we don't meet the timeline because we get off a late start. So
right, and it's fine. I mean, we're pretty flexible about the timelines. That's really more for you and working with your TA lead. So if you end up putting something in your work plan and you didn't quite get there, it can get pushed back.
Okay, great.
We understand the time and the funding and all that. So, and you're just getting these, so I'm sure you need to figure out staffing and all that. So,
thank you.
You're welcome, Pam.
I have two questions.
Okay.
So the emails that were used to sign up for this today, is that how you'll communicate with us moving forward, or will it go to the person who was notified that the grant was awarded?
I think we want the person that is going to be active, the contact person, not so much your development or whoever it went to.
You're making me think that we could add this to our follow-up email to say, what are your preferred email contacts
Good point.
Participating?
Yep, good point. So yeah, and then who your contact person is. It doesn't mean that when we do different topics, like we're going to do a series about issues that come up around vaccine hesitancy in these power hours. So maybe a different person would come. We're going to do one about engaging youth and thought and all the ideas around that. So maybe a different person would come. They just need to be people that are involved with this grant. That's our main request.
So I've already done a needs assessment and am preparing to do, so we in our grant had said that we would do a survey of our constituent base to understand where that equity and hesitancy lies.
Sure.
So is that something that you also need to see the survey before we send that out? Is there information that you
I think if you did it without this funds, we don't. I mean, if you already did it before you were awarded this, I think that we don't need to. But Kelly or I would refer to Kelly as our primary communications person here. I would actually ask her if her thought. I know where she is.
Yeah,
I'm here,
this is
LJ.
Stacy.
Go
Oh.
ahead, Stacy.
I was gonna say you'd love to see it for sure.
Okay.
Yeah, I think your TA would like to, but I don't think it needs to get approved at this point.
Okay, I just wanted to make sure. All right, thank you.
Sure.
Yeah, and I would just add too, we'll go over this in the communication section, but any materials you already have, feel free to send our way now rather than later. We can start to take a look at it.
I think our goal is to help it be as best as good as it can. I'm not sure that was correct English, but anyway, to help it to be good. So and be more effective. So it's really, that's our goal as much as anything. Any other questions right now? And certainly we can continue.
I have a quick question, Laurie Jo. It's Chris Murphy. How are you? If DPH already has information about the vaccine and we wanted to use that and it's already been disseminated and DPH is already using it, do we need to get that approved as well? Or can we already use information that they're using?
You can use that. It's really anything you create that needs to.
All right.
No, that's like, go ahead, Stacy.
I was saying, like, we're going to be going, Kelly's going to be giving us an overview of communication. So maybe we can hold off for these questions till after she's given it, because she has some good background information to provide to everybody.
And I have one more quick question about the work plan. And I know you're going to be talking about that in the last hour. If we wanted, is the work plan going to be planned out for the entire from, May to December, or is it going to be on a monthly basis? And I mean, I know, everybody's grantee award was probably different, and some people may have more capacity to work more hours on certain things. I mean, everyone here is working a minimal amount of hours, and everyone here works part-time. And
right.
I mean, is everyone's schedule, I guess, going to be considered? Because normally we don't work on it will.
Yeah,
okay.
No, of course. And actually, if you are not have any staff working certain days, I don't think we typically plan our Vax Power Hours on Fridays or probably Monday. Okay. We try to keep them to Tuesday, Wednesday, Thursday, because
works for me. Works for me.
We know Fridays and Mondays are harder sometimes, and there's holidays, so typically they're not on Fridays. This one we really wanted to do just get
it. Yeah, I hear you.
Yeah, so yeah.
All right, perfect. Thank you.
Certainly your schedules can be flexible according to what you're doing and who you are. We want to be as supportive as possible around that. So thank you. Dr. Anatello.
Hi. Sort of a similar question just about the work plan. I was just wondering if I know that there are process evaluations built into the grant, which is great. I was just wondering in terms of, do you have a sense of what the process will be like for amendments to the work plan? Only asking because our experience has been that the needs emerge in sort of 2-week blocks of time. So sometimes it's hard to forecast what the need's going to be more than just a few weeks out, particularly as supply and demand really seems to impact what we focus on in terms of our targeting our work. So just wondering if you had a sense of what amendments to the work plan would look like, or how nimble you anticipate and flexible you anticipate being with edits to the work plan.
Right, and someone actually asked about, how the chunks of the work plan, do you need to do it all at once? I'm going to actually let Stacy or Elena or Maya, who've been TA leads, respond to that, but I think it's very flexible.
Stacey. The plan is meant to be a guide for you all and for us to understand what you're doing. This funding source is really meant to support you guys in what you do best in getting out in the communities and providing TA and education and communications. It is definitely, I mean, your TA lead is going to meet with you on a monthly basis. We'll have conversations. If you want to change something, we're definitely going to be in support of that. Does that answer your question?
Yeah, thank you.
You're welcome.
Anyone else? And please feel free to speak. We have a great translation session, translator here, so we'd love to hear anyone who wants to speak, and we'll all hear you. I think it's like an amazing thing. the simultaneous translation. I feel like I wish I could speak Spanish. I don't speak it very well, but I can talk to someone and hear it and they can hear me. So it's a wonderful service. All right. It's going to count to 10. And there will be plenty of other times to ask questions today. We have another hour to go. So, and I think we are ready for a break. So we always want to give people a break in these sessions to stand up, stretch, move around, get yourself another drink. And anyone else on our team? Oh, Bishop, did you want to say something? Oh, you got your break ready?
You caught me. You caught me. But
we have a timer. Go ahead.
I'll wait till after the break and ask the question. I don't want to interrupt the break.
All right. Well,
Okay.
We'll have 10 minutes up on the screen through the timer. We recommend you get off screen, walk around, stretch, and come back when that timer is down to nothing.
Thank you.
Sure.
Oh my God, am I gonna go to my ears, give her a push, ignore it,
Hi all, I know that we've had a couple newcomers, someone, Robin from the Mass Coalition for the Homeless. So Robin, if you would like to introduce yourself with your organization, your pronouns, and something that is that you are excited about spring, that'd be great. And any other newcomers that are here, and then we'll move on with our agenda.
And welcome back from the break.
So Robin,
thanks so much. I'm Robin Frost from the Coalition for the Homeless. And what am I happy about spring? I'm not walking out in the freezing cold with 2 dogs that want to spend 5 hours out there sniffing everything. So I am a thrilled person. So thanks for having me. I'm sorry I joined late.
No worries. Anyone else new joined since the break? Okay, well then I put the slide back up that Elena put up because we had a request for that. Just to let you know, the slides will be coming to you. So this is not your last chance to review them. And obviously, well, not obviously, you can always review these questions with us and particularly with your TA lead when you get them. So I'm just going to move forward with our slides and going to put it over to Iowa.
Great, thank you. And hello again, everybody. My name is Maiwa Sanusi, one of the TA leads. We're going to talk about in this next section just some learnings from the past and some inequities we're seeing presently. Next slide, please. So reviewing history is really important. You know, during this time, it's really important that we look to the past for lessons learned. We know that pandemics are something that we have faced before globally, such as the 1918 flu, which we'll talk about a little bit later. But really, the increase in population size, especially in urban cities, and global trade has created conditions where pandemics can become more prevalent. Next slide, please. So the 1918 flu, there are a few lessons that we can draw from that pandemic. First, telling the truth and keeping people updated was very impactful. Author John Barry, who wrote about the 1918 flu in his book, The Great Influenza, stated the #1 lesson from the 1918 flu is that if you want to prevent panic, you tell the truth. The second lesson we can really draw from here is around physical distancing, which was used as an effective method of stopping the spread of the flu in 1918. Another lesson learned from the 1918 pandemic was practicing good personal hygiene. So like washing your hands, which we've heard a lot about early on, and still encouraging people to do, and wearing masks, which we're also still encouraging people to do, can play a large role in stopping the spread of the virus. Lastly, the 1918 flu pandemic also revealed the role that existing inequities play. So researchers found more excess flu deaths in cities that already had high infant mortality rates and low literacy rates. So existing inequities, which is similar to what we're seeing today. Next slide, please. So we know that the COVID-19 virus is different than other viruses we are aware of today. COVID-19 is airborne and spreads through droplets in the air. And one reason COVID-19 is so problematic is because according to the CDC, it spreads more easily than other viruses such as the flu, which I know was a point that was harped on in the beginning of the pandemic a lot. We also know that asymptomatic and pre-symptomatic carriers, which are basically people that carry the virus but do not have symptoms, are estimated to account for more than 50% of transmissions, according to data from the CDC. And then lastly, since the virus is airborne, the CDC advises against indoor gatherings. But obviously, if you live with family members, that's another story. And then with the vaccine, gathering with vaccinated people, there's some guidelines around that as well. But if indoor gatherings occur nonetheless, the CDC advises that you ventilate the area. As we saw earlier, one of the lessons learned from the 1918 flu was that areas that were where there were many inequities have a greater number of cases. With COVID-19, we're seeing the same in areas where there is a lack of access to essential resources, quality healthcare, jobs that do not require face-to-face service, and safe living environments. Furthermore, we know that unfortunately, decades of racist policies and systems have created the environment for communities of color, especially in this country, to be vulnerable to COVID-19. So as I mentioned earlier, it's helpful to look to the past to understand modern day issues. The graphic here that was created by someone by the name of Derek Young Jr. Illustrates how historic and oppressive systems have led to modern day inequities in the Black community. These modern day inequities are the reason for the disproportionate impact of COVID-19 in the Black community and other communities of color. So just kind of walking through an example, if you point your attention to the first row in the health section, we can see the unethical medical experimentation, such as the Tuskegee syphilis study, which has been mentioned a lot, where Black males who had syphilis were offered treatment by researchers who did not tell them to test subjects that they had syphilis and did not give them the treatment for the disease when they had it, but rather just studied them to chart the progress of the disease. That's one example of many unethical experimentations that have led Black Americans, but not only Black Americans, to report higher levels of medical distrust. And then this leads to disproportionate numbers of COVID-19 cases and deaths in Black communities as a result of trust in hospitals or lack thereof in hospitals, doctors, prevention guidance, contact tracing, vaccines, and treatment due to generational experiences and trauma. Another example that we can walk through in the economic stability section illustrates the effect of redlining. And for those that aren't familiar, redlining is the discriminatory practice of denying services, typically financial, to residents of certain areas based on their race or ethnicity. Policies such as the New Deal cause less accumulation of wealth and lower home ownership rates in the Black community compared to white communities. The lack of home ownership leads to disproportionate numbers of COVID-19 cases and deaths in the Black community because there's a lower chance that non-home owning families will have multiple rooms in their residence, which is important for self-isolation if a family member gets sick. We also see a lot of intergenerational housing in communities of color as well, which is pretty common. So I wanted to pause here and kind of pose to the audience, maybe we could get a few voices. How do you see history affecting how your community is talking about or handling COVID, especially around the vaccine? Also, how are other social determinants such as housing, income, employment status affecting your community? And if anyone has anything to say, you can throw it in the chat or you can unmute. Either one is fine.
I want to say that it's very interesting. The information that you just share is so helpful to go back and see what was, what was the practice back then and how we can actually better inform our community. I serve the North Shore area and now principal offices in the city of Lynn. As everybody knows, Lynn has been hit tremendously. And we are trying to work with the community, inform them as much as we can. So this information that you just share is definitely a good way to start to better inform our community. I thank you for that.
Yeah, no problem. Thank you. Anybody else want to share anything?
I think that's some useful information as well, because I think the main difference here is that the Black men that had syphilis were left untreated, but like right now we have treatment, and I think that's the main difference. And sometimes people don't really understand that difference, and I think that's the message we should really vehicule to the communities, let them know that now that there's a treatment for the COVID-19.
Mm-hmm. Yeah, definitely important to get the full message out there, the full story of what happened with these past things that people reference a lot. So this graphic, there's also more here. We just cut a certain section. So it talks about other kind of historic things that have happened. And I believe we have something that we can share fully with everyone. And yeah, I just wanted to make sure that was clear as well. But any other comments from anybody else, or any type of inequities that you've been seeing in the communities that you work with that have been affecting the rates? Any type of historic things that you know of that people have been bringing up that kind of have caused challenges with COVID? People getting vaccines and things like that.
Yes.
Sorry.
No, ladies first, ladies first.
Oh, thank you so much. So, I think in the Brockton area and Bishop, you might be coming at this from the same perspective too. So some of the challenges that we're having is that the first mass vaccination site was put in Foxborough, and that kind of redlines the Brockton community. A lot of them have the challenges of getting access to transportation. And to get to Foxborough to obtain a vaccine was creating a barrier for people. In addition to, according to the 2019 census in Brockton, 30% of the population didn't have access to broadband internet. And if you consider that people lost their jobs, that probably escalated higher. And so we created an issue where people didn't have access to the technology in order to schedule the appointments to get what they needed. In addition to, there was a lot of language barriers. So I think, we're struggling and we're creating some barriers for some of these communities. I don't know if anyone else wants to kind of go off of that, but that's definitely some of the things that we're seeing in Brockton.
Absolutely. And I was going to mention some of those things. New Life Community Empowerment Center in Brockton, everything that the young lady said, absolutely. I agree with you. It's happening here. It has happened and still happening in the city of Brockton. But also, the young man mentioned the lack of trust. I find, inserting in the community of Brockton, I find that the different ethnic backgrounds here, the trust issue is there, and the getting the word out, the information. I find there's a trust factor for the city, but also a lack of just knowing what's available to help change the community over the years of serving in Brockton as well. And thank you for this information. This is wonderful, wonderful information that I'm going to use. I love research and share with the congregation.
We share that. We share that in common. We share that in common. Then.
Awesome. Rosemary Coelho from JFS in Framingham. We're dealing with a large undocumented population who fear that in order to get vaccinated, they need to produce an identification card, that they need to expose themselves These are folks who've been living in the shadows for the most part. And while, you know, the information states that they don't have to have an identification card, most of the vaccination sites have in fact asked for driver's licenses or some kind of ID. So we've been looking to identify places that are willing to vaccinate absent any kind of formal identification.
Thank you for sharing that. Yeah, I think that's the challenge that's been mentioned. I'm just looking at the chat. There's some other things that have been said around transportation and working with individuals that are undocumented. So thank you so much. I'm just gonna move on. If there's any other things, you could definitely use the chat. But thank you all for bringing your voices into the space. Can we go to the next slide, please? All right. So this just kind of illustrates what is happening currently in Massachusetts. This was released on May 5th, but the data is up to the 4th. Really just want to point your attention to each of these different graphs. So, you know, I think the biggest thing to see that's in common among all four, first one to the top left talks about cases. The one following it to the right is about testing. Bottom left is hospitalizations, and bottom right is deaths. I think the trend to see is that things are going down. The number of cases have been going down. There was a little bit of a peak, I think it seems like around mid-March or so, but it's starting to really go down. The biggest peaks was around, I think, the holiday times, which I think people were familiar with when that was happening in terms of cases, in terms of hospitalizations and deaths. But the largest, peaks for hospitalizations and deaths were really last year in April. We were seeing a lot of hospitalizations and deaths there. But I think the biggest takeaway from these different graphs are things are going down. The cases are really coming down. The hospitalizations are really coming down. The deaths are really coming down. The percent positives from testing has really been coming down. And I think if you look at the graphs and kind of keep in the back of your head the timing that the vaccine was starting to get rolled out, I think a lot of that could be attributed to vaccine work that's been being done and other factors, of course, as well. So I think that's really what we wanted to highlight here on this slide. Thank you.
So we're going to move over to our colleague, Kelly, to talk more about messaging and content.
Thank you, Stacy and Maiwa. So my name's Kelly Dankert. Again, I will be a TA lead, but I also work on the communication end of things. So I will be supporting you all in spreading these key messages and mitigation strategies that I'll be going over in just a minute. So if we go to the next slide. Currently, this is our favorite way to describe the current mitigation strategies. Because COVID-19 is an airborne virus, there are many, many different pathways it can take. So to address this, there are actions we can take on the individual level and actions we can take on the collective level. All of these are imperfect, and there are ways that the virus can get through. So it's important to have a combination of all of these personal and shared actions so that we can create that airtight barrier against COVID-19. So for example, where social distancing and wearing a mask might not work, maybe that layer of vaccine will, maybe that layer of hand washing will. So the idea here is that when there are several layers of interventions, despite their individual weaknesses, they can be properly stacked against COVID-19. And this is a really handy infographic too that you all can spread and disseminate to your community members as well. So when it comes to this grant, if we go to the next slide, we are truly here to support you all spreading key messages and mitigation strategies to your communities. So these key messages will be consistent to messaging that's happening at the state and the federal level. So all of your communication activities can and should align with state messages, but also be represented by your community and organization's work. So for example, I know, Chris, I believe you asked, can I use state materials that are already developed? The answer is yes. There's no need to reinvent the wheel when there are tons of resources out there that you can spread to your community members. So you can make sure that your work is represented by your organization, but also change and adapt to make sure it's relevant to your community. So address specific barriers that your folks experience and provide additional information and resources to residents that is unique and relevant to your community too. Translate to languages for folks who live in your community and use communication channels that are appropriate for your folks too. For our current cohort of grantees, we have people who are communicating using WhatsApp, folks are posting on Twitter and Facebook, using door knocking techniques. So you all are the leaders in your community, you know what works, and we are here to just make sure that we are supporting you in spreading these key messages. So what are these key messages? If we go to the next slide, in short, they are constantly changing. They are constantly changing, constantly being updated, and we will continue to update you on those changes throughout this grant too. We pay attention to governor updates, to state updates, and as more people are getting vaccinated and as the state reopens, we will be communicating those changes to you. You can view us, the TA leads, as really your bridge between your community and the Department of Public Health too. And I believe one of my coworkers wants to jump in. Stacy, do you want to add anything here?
Kelly, actually, I'm wondering if we can just take a moment and look at the chat. And I'm hoping that Emily Getchell, if you're able to read this chat to us out loud and maybe translate for us.
Okay. Can you hear me now on the English channel?
We can, yeah.
Okay, great, thank you. So it's a good observation that people who do not have any ID have not been able to receive the vaccine. A good alternative for those people would be if organizations could take care of the most vulnerable communities. Yeah, so a good alternative would be the organization so that they could take care of the most vulnerable communities. Would you like me to ask for clarification on that one, or is that understood?
No, I think that makes a lot of sense.
Okay.
So thanks so much, Glenda, for sharing. We definitely know that especially all of you at your organizations are doing this every day, really caring for those who are most vulnerable in the hardest hit communities by COVID-19. So thanks again for sharing that. And thanks, Emily, for translating. Kelly, we'll throw it back to you.
Great. Thank you. And again, thank you all for bringing up these concerns too. It's really important to elevate these because I know for the issue around identification at vaccine sites, particularly for undocumented folks, we have provided that feedback to the Department of Public Health, and they're working on creating resources and pamphlets for providers across the state as that reminder that, you know, you shouldn't ask for this, you shouldn't turn anyone away. So it's really important and keep elevating these concerns to us. But as far as spreading these key messages in your community right now, as we know, it's wear a face mask, wash your hands, keep your distance, avoid groups, stay at home, isolate, and get vaccinated too. So you can spread these messages through whatever communication channels make sense for your community. And as guidance changes, we will continue to update you as well. So if you go to the next slide, I know a lot of guidance has been updated for folks who are fully vaccinated. I also want to pause here and apologize that It's trash day on my street, so if you hear anything, it's currently in front of my house. So thank you for your patience. But when it comes to communicating for folks who are fully vaccinated, the guidance is still, when you're in public, continue to wear a mask. Continue to social distance where possible. Stay at home if you feel sick, and continue to isolate if you test positive for COVID-19. There have been some guidelines that have been relaxed, particularly around the mask mandate in public spaces. So for folks who are fully vaccinated for COVID-19, if you're in outdoor spaces, the guidance says that you don't have to wear a mask when you can properly socially isolate. But again, just to reiterate, fully vaccinated means you have your 2 doses of Pfizer or Moderna, or your single dose of Johnson & Johnson, and you hit that 2-week period afterwards for full inoculation. So about the available vaccines, and again, these are all things that you may already know and can communicate to your community. So there are 3 vaccines that have received emergency use authorization from the Food and Drug Administration, and these are Pfizer, Moderna, and Johnson & Johnson. All 3 vaccines are safe and highly effective. Pfizer and Moderna require 2 doses. Johnson & Johnson is only 1 dose. People are not able to choose which vaccine they can receive. They will receive whatever vaccine is offered to them when they get to their appointment. But I see, Lucy, in the chat, you brought up that Johnson & Johnson, we have heard challenges around vaccine hesitancy, but we do want to reiterate that all the vaccines are safe and effective. And, we hear community feedback that after the pause, we have seen increased hesitancy for vaccines. And these are all things that we want to support you talking to your community about. When it comes to rates of COVID-19 vaccination in Massachusetts, we have hit about 6.3 million doses administered. For folks who are fully vaccinated, around 2.6 million. And for the percentage, about 53% of people in Massachusetts have received at least 1 dose. And this is based in daily and weekly reporting. Each week, we'll be updating you on where the numbers currently stand and continuing to make sure that we get folks vaccinated when and where they can. So for getting folks vaccinated and for spreading these messages to your community, we want these key messages that we've been reflecting in the PowerPoint to get to your community members through whatever communication channels make sense for them. This can look like fact sheets, flyers and posters and signs. I'm sure many of you have seen the state's materials around trust the facts, get the vax. I know for me, in front of my house, there's a bus stop that has a big billboard there. You can share this information via social media posts, through video campaigns, audio and radio. And there are resources available on the state that are available in up to 11 languages, and we have a lot of resources for you all to use. So yes, you can create your own content, but again, you don't have to. There are tons of resources available, and we are happy to support you in disseminating that information as well. So you all can download and print materials, you can request files for printing and production, and you can do this all through your TA provider. We are here to support you in whatever way we can to get these messages to your community members. There's been a lot of information so far, so I just want to take a quick break for any questions.
Carrie asked if it was 53% of people eligible have been vaccinated. I believe that is the statistic.
Yes. Thank you for clarifying, Stacy.
And Orlando, you're going to get the PowerPoint presentation if you're taking pictures.
Some examples of
Thank you.
some examples of these state materials that I've been talking about. There are anyone's from, flyers and fact sheets, but also whole guides too, to hosting your own community forum on the COVID-19 vaccine. But there are also lots of fact sheets available that we can get to you and that are available for download as well. As far as more communication support too, we provide weekly Vax Power Hours, which are 1-hour sessions for any additional support that you need. We give you updates. We provide any new and relevant information that the state has released. We provide targeted support and DPH materials. And just given the current vaccine hesitancy rates that we've been seeing kind of as a response to the pause for Johnson & Johnson, we are launching a vaccine hesitancy series during our Vax Power Hours. So we'll be talking about how we can leverage personal relationships, community relationships, and community norms using things like motivational interviewing to really make sure that we are meeting folks where they're at and getting to the heart of why folks are hesitant and how we can change that behavior to encourage folks to get the vaccine. When it comes to developing these communication materials, we do have a pretty rigorous review process between us at Health Resources in Action and the Mass Department of Public Health. And this review process is really just to make sure accuracy and consistency among key messages. So making sure that the materials that grantees are producing align with state and federal guidelines and reflect all the best practices for communication. So with your TA lead, feel free to share any materials you create under this grant that includes information around COVID-19 vaccines and how to access them. We will only submit materials to the state that we think requires their approval, and the entire process should take about 2 to 3 days total from when you submit to your TA lead. We really want to balance the communication goals with also ensuring that the communication materials get to your community pretty quickly too. Guidance changes all the time, and we are here to help you update and reflect your information. But again, feel free to use existing materials for your community. And if you have any materials that you've already developed, feel free to get that to us as soon as you can, and we can get that review process rolling. Some examples of things that might require that additional Department of Public Health approval that I just mentioned are things like fact sheets, things like posters, especially billboards in your community, any ads, a social media campaign, and particularly video and audio content too. So we encourage you to share early, just so that we can get you feedback. And this is particularly true for the video content. We would love to see scripts beforehand because we would hate for you all to start production when there might be some approval processes that are needed to go through. Examples that don't require DPH approval are any like the occasional social media posts, simple materials promoting an event, presenting using the state's hosting guide, which was mentioned on a few slides back, English state materials, and state materials you are translating. So we will continue to offer trainings, resources, and materials in your work too. I mentioned that one of our review criteria is around just best practices. So as we are reviewing your communication guides, we are thinking about is there a clear purpose? Is there a clear need for the material? What problem is it addressing? Is the content consistent and accurate with the key messages that we are getting from the state and from the federal government? But also too, what is the visual accessibility like? Do fonts and colors and graphics make it easy for people to read and understand? Is the language simple across literacy levels? Vaccines and COVID can be really complex topics, so we want to support you all into making sure it's as easy and accessible for your community members to relate to and understand. And is there a clear and simple call to action? So once they know about the different vaccines, is there a call to action for folks to get it? And these are just a couple of questions that we'll be asking ourselves while we review your materials. I know that was a lot of information, so I'm happy to pause here for any questions.
And a lot of people put really good things in the chat to share as well.
Yes, thank you.
I'm wondering about multilingual resources that are on the state site, and it wasn't included in your approval, your non-approval list. Is there a reason?
English versions for the state also aren't included in our approval process. I think as long as materials are created by the state, they don't need to see it and approve it across languages. I'm seeing Kathy in the chat ask, what about multilingual radio interviews? These include calls from listeners and cannot be fully scripted. I think, Stacy, do you want to take that question?
Sure. So I'm assuming you do it on your own, like Facebook Live or something. That does not need to be approved beforehand. If you are going to be doing some kind of interview with a radio station that you've been invited in for, we would ask that you let us know so that we can let the state know. They'd like to know what's going on. So they don't want to turn on the radio and hear that you've been funded by this program on your, on some program for a half hour. But, obviously, if you get a call from a reporter, you get a call from a reporter and you're talking to them.
Thank you. I think when we talk about radio and video campaigns, these are really those scripted, targeted, structured media campaigns. Those are the ones that require approval.
And are there any particular logos? Like, should we be using a specific logo that you want us to put on anything, or?
Yes, your logo.
Okay. No, I didn't know if there was something from, your organization or Department of Health that they wanted us to put on there. I know sometimes we are asked to put those other logos as well.
Yeah, Pam, we do have a logo for this grant, and you are welcome to use that on your materials that you do develop. So we can send that out to you, but it's just the MA COVID Community Grants logo.
All right, great. Thank you so much.
And if my recollection is correct, you can also use the state's materials and put your own logo on that. And I think they're even fine with you, I'm going to forget this part, taking their logo off if you're not altering it.
That's right, Stacy. Yep.
We are going to move into breakout groups to make sure you have some time for networking. So if more questions come up, that's a place to ask them. You can also bring them back here and continue to think about them. So unless there's anything more burning, maybe this would be the time to do that. We do have a 3-hour span, and I was saying if we do finish a little early, that will be more time for open questions too. So, but we do want to get you to talking and meeting some of the other grantees and sharing some of what you're planning to do, because that's a great time to. We really hope that these sessions and our Vax Power Hours will be a time not for just us to give information. I mean, I know today it's really about that because you need to know and you probably want to know, but we really hope to hear back a lot from you and take what you're doing. The state really wants to, really wants to know what you're doing, because you're the people that are on the credible messengers, the people that are doing this work. So does that make sense to move on? We're just going to show you quickly the work plan, which you can also talk about in your small breakout groups. This is an example. This is just one we made up. I mean, the template is the same, but so table and conduct outreach at a local supermarket, your time, your people, and what you're hoping, what your outcome is that. What are you hoping to achieve by doing that, your intended outcome? Again, this is flexible. If it needs to change, it can, but we do really hope that you get out through the, try to map it out a little bit from May through December. If you can't quite get that, that's probably okay. But as much as you can do forward thinking, that's helpful for everybody. And it definitely can change, because it will probably. And that's what we hope your TA lead can really support you with. Any burning questions about the work plan? Because this is what you can talk about in your small groups. We will have a next Wednesday. They are due the 12th at 5 o'clock. We will have the Vax Power Hour. It's not mandatory next week, or it's not, you don't need to come unless you want help with your work plan or other drop-in questions if you have questions. But that will be it's kind of close to the deadline. It's 3 to 4 on Wednesday, but maybe you have those last minute questions. So, all right.
I have a quick question.
Sure.
What happens if you cannot get the work plan done by that Wednesday? You already have other commitments.
Good question. I think at this point, I'm just going to ask that you communicate that with Stacy.
Okay.
Maybe Stacy, if that's okay, maybe you could give you your email, just because
I already sent it. I already asked that question and sent it to the COVID outreach email, but I haven't heard anything back. So.
Okay, we'll get back to you about that.
All right, perfect. Thank
Stacey,
you.
Stacey, if you don't mind, maybe you could just touch base with Chris about that. We will be getting your official TA lead sometime in the next week or so. So then that will be sent. We just haven't got there yet because we're staffing up also as you all are. Stacey just put her email, so ask her. And we will try to check that Web Central place as well. All right, so I'm going to pass it over to Jasper, who will tell you about how we're going to do workshops, breakouts.
All right, so what I'll be doing is in a moment, I will open up 4 breakout rooms. The staff who will be in those rooms will be Elena and Bethel for group 1, Tamaki and Kelly for 2, 3 is Maiwa, and 4 is Stacy. We ask that if anyone needs interpretation to please join breakout room number 4. So Emily, as you're hearing this, please join breakout room number 4 for folks who might need translation services. Other than that, we just ask that folks jump into whatever breakout room makes sense for you. I mean, all of our TA leads can provide you with the same information. We just ask that you divide yourselves in roughly equal amounts to each of the 4 breakout rooms. And breakout. Sorry.
Oh, sorry.
You're fine. And so we just ask that you try to split yourselves up roughly equally for the 4 breakout rooms. And breakout room number 4 isn't just for folks who only speak Spanish, so please also join that one as well. All right, so I'm going to open up the rooms, and if for some reason you have issues clicking and joining a room, feel free to stay in the main room and we can help you get where you're going.
Should we be joining the same breakout rooms as the rest of our team, or should we be splitting up?
Totally up to you. Totally up to you. Whatever you think is best, if you want to try to get maybe different perspectives and network with other organizations, or if you think it'll be more useful for everyone to be in the same spot, that's totally up to you and your organization's needs.
You might text each other quick and figure that out.
All right, so I opened up the 4 rooms, and like I said, if you have any issues joining a room, please feel free to either post that in the chat or just stay in the main room and I can help you out.
I love this new feature. Again, it doesn't matter which one unless you want the Spanish translation, then that would be 4.
Okay, any folks who are still chilling in the main room, do you need help getting to a certain breakout room?
We can have more in 4 if folks want to go to 4. Anyone can be in 4.
Is it possible for someone to just move me to a room? I don't know if I can see it on my phone, like the option to go to a breakout room.
Sure, not a problem. Do you care
Thank
what
you.
you get moved to?
No, I think it's anything is fine. Thank you.
Okay, sounds good. I'm going to move you to breakout room 4.
Okay.
Francesca, do you want us to move you or you?
How to move to the breakout rooms again?
Sorry, James, do you want us to move you?
That would be good because I do not know where to find that option.
Okay.
Sure, not a problem. Do you care which room you get moved to?
Well, I don't speak Spanish, that's all. But other than that, anyone is fine.
Sure, sounds good. I'm going to send you to breakout room 1.
Okay, thank you.
Sure.
I don't get the option in here to move to another room. So if anyone can move me, please. Thank you.
Sure, I will move you to breakout room 1 as well. Sometimes that option won't pop up if you don't have the
It's
link
not
search.
showing up. Thank you.
Okay. So you should be all set.
Sabrina, did you want to move to a breakout room? Or Chien?
It looks like Sabrina, I think, is trying to join room 3. It looks like it.
Okay. Oh, she went. Wasn't Chien might not have been there at the, remember maybe she wasn't there at the very beginning. I don't remember. Somebody wasn't, but.
I don't remember, but I think I can try moving them to breakout room 2 because it looks like some of the other folks maybe from
makes sense
for health are there. All right, so if you can hear us, I am moving you to to breakout room 2.
Oh.
You also might be away from.
Yeah, they just might not be there.
But that actually worked out much better than expected. So that was nice.
Wow, that was quick thinking, my friend. That was great. You were very smooth with that. I should have thought of it because I actually didn't realize we were having translation until Elena said that at the beginning. Because when we do it in Paso, we have people identify themselves as English speaking bilingual on their name when they rename themselves. But maybe in this context, maybe people, because everyone is, most people are bilingual or Spanish speaking. So, but maybe in this context, people wouldn't want to. I don't know. Maybe that would be not comfortable for people to identify. And that way, then you can just move people into either bilingual or English speaking or Spanish speaking only. So that's another way to do it. But I think the choosing way worked perfect.
Okay.
Totally understandable. I wonder how many people actually listen to the recordings. I have to say, I don't do it very often.
I'm going to go on mute. There's another dog barking, I think, that he hears.
Oh, look at those little ears. So cute.
No, they're like little, what do you call them? Like satellite dishes.
Oh, sorry. Did you hear me?
We heard the very tail end. Chinchi, we can follow up with you about that. Sorry that you were cut off.
Oh, okay. So I was saying that it would be helpful if we can get media, like reporters, contact information for the mainstream media, or the media buy as well. Yeah. And particularly, like ethnic media outlet, like Asian media.
Chinchi, we'll get back to you on that. We will internally kind of discuss that and then collect any information that might be helpful to you.
And Stacy, was one of your participants wanting to finish their question? You're muted. When you come back from breakout room, you're always muted, everyone, just FYI.
Maria, you could send your question to me if you want.
Any other follow-up questions? We're just gonna take any questions or anyone who wants to shout out a great idea you heard from in your breakout room. And then we're gonna move to closing. So we will be ending, and as we had said, giving time if you want to stay till 2 with your own questions or concerns. We're happy to, we will be here. It's more of an informal time, but our formal time, we're gonna move to closing, but first love to hear anything you wanted to share or heard or learned in, or questions, more questions.
Our group talked about maybe every Wednesday at the beginning of the vaccine power hour, just kind of shouting out some clinics, vaccine clinics that are going on. That way we can kind of learn where they are. Like I know Brockton has one this Saturday at the Westgate Mall that I put into the chat. But I think that that would be helpful for all of us to, since it's not centrally located really anywhere.
Great idea. Jennifer put something about in the Roxbury area, vaccines at the MAC. Other thoughts or questions or affirmations that you want to share? I know it's hard to talk in the big group sometimes.
If no one does it from our group, I'm happy to lift up some great things I heard.
Why don't you go ahead? Because go ahead, Stacy.
I just heard, well, one of the ideas was doing, doing these vaccine events, but adding music, trying to get some mobile vaccines and trying to get people there, I guess, pumped up to get vaccines. The other one was one of the grantees talking about being in their own community and coordinating with others within their community to find out where some of the areas that are not being served as well in terms of education, so that they are, there's actually no problem with duplication of services, obviously, because we need reinforcement, but also trying to make sure that reaching areas that are not served as well. And I also want to lift up, we had a longer conversation also about the issue about IDs and asking for insurance. Anyway, lots of good ideas. I'm just lifting up those two.
And Samia raised her hand. I apologize if I'm saying your name incorrectly.
You know, earlier in the presentation, you guys present the graphic, you know, like how things are going with COVID, how many people have been vaccinated and stuff. I love those kind of things. So my question is just like, are you guys planning to show any kind of graphic like that for us during this process? Like, so we can see how our work has been reflecting to the numbers, you know, and that would be very interesting. I would love to see something like that if that's possible.
So sort of ongoing update of statistics would be helpful. Okay.
Yeah.
Good to know. Certainly can do that as much as we have. Sometimes it takes a while to get the data, but. And if you all have any data, some of you have access, please bring it.
Well, I mean, upon that point, Elena lifted this up before. We are going to be asking you for weekly updates, so that we share with the Department of Public Health. And I just want to really reiterate the importance of that. It's our opportunity to show off for you all about how you're shining. And this information goes up to the commissioner's office at the Department of Public Health. Sometimes we get a request that from the governor's office or the Department of Public Health that the commissioner or the governor wants to come to an event, so they'd like to know what's going on. And we'll be talking more in future Vax Power Hours about something called community liaisons, ambassadors, but they're also trying to coordinate. But I would say that the reason that you're all sitting here today is because of the good work that community-based organizations and faith-based organizations have done, that either through this grant or otherwise, and the acknowledgement of the importance of that. So we need to show off as much as possible about the great work you do.
I just want to highlight two things in the chat, one about Lowell and one about Malden, where there's some vaccinations happening. So you could check there as well. But any other things that you want to highlight or things that you want, which really appreciate Samia and whoever said it about the vaccination sites being brought up. Sorry, I said that. But any other things that you would be helpful to you? As I said, we have, our intention is to do some work around vaccine hesitancy and how to address that. And then also working with young people. I just heard today that it was Moderna was down to 12 to, I think 12 to 16-year-olds now. And this, I just heard this on the radio, so it's not, we'll get you the exact information. But it was interesting because the thing that they said was that a lot of times mothers are the ones that are concerned about their children getting it. They're more the concerned one in the hesitancy.
Just quick question. Do we have anything informative around anything like that for younger women in particular who are concerned about reproductive repercussions?
Yeah, I will send that over to Stacy to see if there's, that certainly has come up a number of times. But Stacy, did you want to respond to that?
I can, and the team, I mean, there's no evidence about that, about the impact of, and actually pregnant women and young women are being encouraged to get the vaccine. So, I mean, I think that's a message that we're going to be sharing. Kelly, I know that we have some stuff that we've shared in past Vax Power Hours, and we could certainly address that as potentially as one of the hesitancy topics. But Kelly, do you have anything to add?
Main thing to add is that you can email your TA lead with any of these like specific requests to, and work with them to get you those resources as well.
And you'll know your TA lead sometime the next week.
Yeah. I also want to add that whenever we're dealing or talking to people about concerns about you know, their own personal health, that they should be talking also to their own physicians or clinicians.
That's the main thing that I've heard. And they seem to be a very credible someone people listen to. They have a lot of influence. And Hannah Tello put up a website that they have about pregnant and breastfeeding people. Jianqi, did you have a question or thought?
Yeah, not a question. Just wanted to add to the messaging to appeal to pregnant women to get their shots. I've seen messaging that they say that, you know, the vaccination will pass down through them to their unborn baby. So that would be a good, effective messaging, maybe, for pregnant women. And also for certain community, I think that to use the message like, you know, take this vaccination so you can not only protect yourself, but also your family, your loved ones.
Yep, that seems to be a strong message. Elena, would you want to say anything from your group? You want to add anything? And then Maiwa, I'll ask you the same.
Sure. So our group, we talked a lot about using different outreach strategies in people's approaches. And it seems like in our group, there were multiple organizations who are focusing on food insecurity, part of their services. And so through food pantry services or through food deliveries, they're infusing that COVID-19 mitigation and vaccine education through those services.
That's great. Maiwa, did you want to add anything from your group?
Yeah, I think really where we spent the time was there was a lot of commonality around working with grassroots organizations and community members directly. And there was another kind of common thread around hesitancy among youth for various reasons. So we just talked about that as well.
Yeah, that will be a hot topic, I think. Moving on. I've already recruited some young people we work with who got vaccines to come talk about what made them get it. And we have some young people here, so that would be wonderful to hear from you all. Kelly and Tamaki, anything you want to add from your group?
I think a few members of our group already shared, but I would just echo everything that Maiwa said, that there was lots of synergy among the folks in our group around getting translated materials, around getting surveys to young people, and addressing vaccine hesitancy.
Great. All right. Well, I think unless we have any other comments and thoughts, and I know a few people had to drop off, we will, if you maybe share that last slide with our reminders about what's coming.
Can I ask one thing?
Yeah, of course.
Yes, I have a question about how are we going to deal with, some of the written information that the hospital gives you when we're having the shots. It's different than what it's been said. That it's okay, it's secure, and in the document it says that we don't know about the risks. We don't know exactly what's gonna happen. We don't know if it's 100%, effective. So how do we deal with that? Where can we find the, someone that can explain that part to us? When we're trying to invite everybody to have the vaccine, but we don't, we're still in the air on a lot of information.
So just for clarity, to restate your concern is that we're telling people it's safe, go get a vaccine, it's our push. And yet when they get there, they have to sign off for permission on a statement that says there may be risks and it may not be 100%. I would just respond to that, and I'd love Maiwa, Elena, Stacey, anyone else, Kelly or Tamaki to respond to, or Jasper. But I would just say that is always what medicine is. I mean, any medicine you take has precautions. Any aspirin has precautions. And ultimately, it's about balancing COVID against something that isn't, we're never going to know 100%. And I know it feels, because we're saying is that I probably wouldn't say 100% safe. I would probably say it's very safe. What we know is it's very safe. Because that's what 98% means, or 96, I don't know the exact percentage. It's effective. It's 96% effective, I believe. But safety is something that's a part of medicine. And I think that is important to not say, we've told, I've done a lot of work with young people around substance use. And we've told for years, oh, drugs are, we've said it, but the message is drugs are bad, drugs are bad. Drugs are not bad. They do amazing things for people. And yet it's how they get used and how they might be integrated. So I think it is about having real conversations with trusted people like yourselves, like doctors, like clergy, like imams, people that people really trust. That's a part of it. So that's what I would say. Please, other staff or other folks in the audience who are experienced here, please feel, Bethel too, feel free to respond.
Yeah, I would add that a good analogy also, right, is the flu vaccine. Right, we always encourage folks to get the flu vaccine, and you can still get the flu if you have the vaccine. It'll just be a lot less severe of a case, and it will help protect you against other flu variants, right? So I think using some of the similar language around that might be useful.
Nice point.
I think a good point to make is this week is Nurses Week. And when we think of the vaccine, one of the primary concerns is overcrowding of the hospitals. So that's kind of, taking a spin on Nurses Week and thinking of how can you share that type of message out about helping our nurses and keeping them safe too. So.
Nice. It's ongoing, Maria, I think, but I hear your point. And, maybe even to talk about that up front. So when people go to get their vaccine, they're not, whoa, where does this I have to sign? Kind of a thing.
One of the things that I would probably share with them is that this is an opportunity to get back to normal. So why not try it? I mean, we know we're here where the virus is really bad. It takes lives. And I think it's doctors and nurses and scientists are doing their best to keep us safe. So we have to try.
Right. Good points. All right. I think and please going if you have more things, but I think we'll just get to our last slide just for our reminders. And if about what's next steps. think we all know the work plan is due, but if you have challenges with that, please contact, at this point, you can contact Stacy as our lead TA. Any revised budgets or things that you haven't signed off on, those need to be signed off as soon as possible, because that's really what, when you get your funding, that's based on that. So you need to sure you do that as soon as possible. Ask us questions if you have them. As soon as we identify your TA, then you'll be contacted, but we're going to start our one-on-one TA sessions that, as Elena pointed out at the beginning, there'll be a monthly or more TA session, in meeting, connection. Sometimes people are communicating a lot more than that, but at least that one-on-one once a month. The Vax Power registration, we're excited about. It is a weekly. Mostly sometimes we take weeks off, things like that, like this coming week. Your work plans are due, and it seems like it was too soon, but we are leaving it as an opening time again for drop-in, like office hours kind of a thing. So you will get the registration for that in probably a big follow-up email with these slides, with the feedback form, with the recording. What else, Jasper? What else am I missing? And the registrations for the Vax Power Hours. I'm not sure that will all be in one, but at least be in one. Also, let us know who the contact person is if it's not who's getting the information now. Anything else I'm missing, anyone? Well, if you would, I think we are moving to close. And so if you would put in the chat, maybe one word about what you're taking away today, or one or two words, you can do a hyphenated phrase. That would be lovely to see anything you're taking with you, anything you appreciated, anything you learned. And we will see you, if not on the 12th, we will see you on I believe the next one is a week from then. I don't want to say the date, be wrong, because someone shouted out. I think it's the 19th, but I can look really quick. Just to give it to you. Thank you. Oh, I seen in the chat, Hope. Looking forward to learning. Have a great weekend. Community efforts. Yay, really good things there. And what else do we got? The next one is the 19th from 3 to 4. The next one where we will see you at. Thanks for the support. Lots of session for this session. Education is power. Happy Mother's Day. Yay. Possibilities. Thanks. Okay, so have a great day. Please stay, and you can unmute and say bye if you want to leave. We are here till 2, which is another 15 minutes. So please stay. A couple people have to move on. Jasper, bye. And but thank you very much. Jasper was our whiz tech person today. And thank you, everyone. Bye. You can unmute and say bye if you want. Bye. Bye. I know you're trying to.
Happy Mother's Day. Happy Mother's Day to all.
Thank you.
Thank you.
God bless.
Thanks,
God bless.
Linda.
Looking forward to working with you guys.
Us too. Thank you.
Thank you, everyone.
Bye.
Bye,
Bye, everybody.
everyone.